There are media who have already joined us. We are not live yet online, but media are present.
Got it.
And we will get started in just a minute. Lasheen didn't get the PowerPoint slides yet. Hey, did you get a chance to send Lasheen the slides? She didn't get them yet. Hi, everybody. We will get just started in just a moment. Good afternoon, everybody. Thank you for joining us today. As you know, I'm Kathryn Goodman with the Blue Ridge Health District, and we welcome our media partners that are here and our panelists as well from the health department. We were having a few technical difficulties, so I apologize. You think that we would be used to this after using technology for so much of the past year and a half. I'm going to share my slides and we will get started. As per usual, we will go through the media partners who are here, and each media specialist will have the opportunity to ask 2 questions, and we will do 2 rounds of questions after the brief presentation. So if you'll bear with me, I will share my slides and we will get started. All right, will someone just confirm that they can indeed see the slides? Okay, great. All right, well, thank you again for joining us today. As I mentioned, I'm Kathryn Goodman with the Blue Ridge Health District. I'm joined here today with Dr. Denise Bonds, who is our medical director, Ryan McKay, who is our COVID incident commander, Jen Fleisher, who is our COVID vaccine project manager, and a handful of our great media partners. We are going to start today's presentation with providing an update on our COVID case numbers throughout the district and what we're seeing. We will then talk about testing, resources, and availability, and then we will talk about vaccine updates regarding 3rd doses. So first, I will pass this over to Jen Fleisher and Ryan McKay to provide this update.
Thank you, Kathryn. To start, just a little bit of information about where we are with our case rates and testing percentages in terms of positivity. We have been seeing an increasing number of cases on a daily basis, really for about the last month or so. So this current surge that we're experiencing has happened somewhat quickly. And I think the other thing to keep in mind is that based on the case counts and where we are with our social settings, masking, and the requirements that have since been lessened, so to speak, since the executive orders ran out earlier this summer, we're seeing a growing number of close contacts associated with each of those cases. And so the line list that we use with the number of people who might be considered a close contact is also increasing, and sometimes in a pretty large number, depending on the setting that individuals are in. So just something to keep in mind as we're moving through this is that while case counts are increasing, we're also seeing more close contacts because we have opened things up more since the end of June. So one of the things that we're seeing, which is similar across Virginia and across the country, is that those who are testing positive are largely those who are unvaccinated, whether they are those who aren't currently eligible to receive the vaccine, so children who are under the age of 12, or adults who, for whatever reason, medically can't get vaccinated, and then obviously individuals who have not yet received their vaccine. And so this variant, Delta variant, is much more contagious that we've experienced so far. And we are seeing that in terms of the cases and the numbers that we are seeing. A lot of the settings where we're seeing individuals test positive is in situations where masking and other mitigation strategies, such as social distancing, particularly in indoor settings, may have prevented those cases from occurring or outbreaks from occurring. And so we continue to recommend and reiterate the critical nature of wearing masks in indoor settings, particularly for individuals who have yet had the opportunity to get vaccinated, which is why the governor and the commissioner of health have instituted mandates regarding masks in school settings, K-12 settings. So it's really critical, given where we are with schools, particularly that they'll be within 3 to 6 feet as opposed to 6 feet, that those masks will be a critical step in minimizing risk of transmission. It may not completely eliminate, but it really minimizes the risk in those settings. And really in public settings as well. So anytime we're indoors, individuals, regardless of vaccination status, we want to make sure that those individuals are wearing masks in indoor settings, particularly if it's a setting where there are a large number of individuals in a close area, to really try to minimize or reduce the spread. And we've really been seeing this increase in cases across the district. It's not necessarily attributable to one particular outbreak or one particular locality, but the spread has occurred across all of our districts. So for example, we've seen low to moderate spread through mid-July in each of our localities, but now we're seeing high or substantial spread, which are the two highest categories for VDH and CDC. So we are definitely in the midst of this surge. Cases will continue to increase as we continue to see more individuals, particularly those who are unvaccinated, come into close contact with each other over the next several weeks. Our positivity rate has also increased over the last several weeks. So we were in, depending on the week or the day, somewhere around 1.5 or 2%. And now we're over 5% in our positivity rate. So that's also an indicator that we are in the midst of a surge and seeing more cases throughout the district. And now I will turn this over to Kathryn, who will talk more about testing in the health district.
Thank you, Ryan. So as with an increasing load of cases that we're seeing throughout the district, we are increasing testing availability throughout the district. I will first share that we mentioned this last Friday, we made this announcement, but effective this week, the Blue Ridge Health District will no longer call individuals who test negative for COVID-19 from one of our health department testing sites. Instead, we're encouraging everybody to sign up for UVA's MyChart, and that's where they can receive their test results within 12 to 24 hours. So it's a fairly quick turnaround, and that's the best way we recommend people to get their test results. We will continue to call individuals who test positive. But again, we will no longer be calling individuals who test negative. They will have to get their results through the UVA MyChart. And we're available to help individuals register for their MyChart account. And this is just the quickest way that they'll get results. And those results will be available within 12 to 24 hours online. It should also be the appropriate documentation that anyone would need for any traveling purposes or returning to work. Along with that, we are increasing our testing locations beginning this week. We will be also increasing the age limit for who we can test. So we formerly were testing individuals ages 6 years and older, but now the Blue Ridge Health District will be continuing to offer our free drive-through testing sites, and this will be for individuals ages 2 years and older. We still do not require any symptoms, and test results are available within 12 to 24 hours through MyChart. We have testing in all of our localities. So in every county or city for the Blue Ridge Health District, there's testing on different days, as you can see listed on the schedule here. And next week, we are excited to be starting a new program where we will be offering testing in the former JCPenney location parking lot at Fashion Square Mall. And this is a way for us to increase capacity for the number of individuals who can be tested at one time. We will have 200 tests available, and this is a great partnership through Seminole Trail Property Management. And of course, UVA is continuing to offer testing on Mondays and Tuesdays at their locations in Charlottesville. And our goal is to be able to provide testing to any individual who needs it, especially as schools are reopening. We realize that testing is still an important piece of this pandemic response. And I will pass now over to Dr. Bonds to talk about third doses.
Good afternoon. So last week, the FDA approved a third dose for individuals who are immunocompromised, and the ACIP, the Committee on Immunization Practices that advises the CDC, did go ahead and vote to recommend this. So we are now offering third doses for anyone who is moderately to severely immunocompromised. This third dose of vaccine should be 28 days from their second dose of either Pfizer or Moderna. And moderately to severely immunocompromised individuals who meet that category might be individuals who had an organ or stem cell transplant, or people who have advanced or untreated HIV infection, individuals who are currently undergoing treatment for cancer, or certain medications that an individual might take that would weaken the immune system. The CDC and the FDA both recommend ideally that you get your third dose of the same manufacturer as your first two doses, but it's not required. So if you come to a location and had Moderna to start with, and the only vaccine that we have available is Pfizer, it is acceptable to get Pfizer as your third dose. At this point in time, this recommendation does not apply to any individuals who have received Johnson & Johnson as their COVID vaccine. Both the FDA and the CDC are examining the evidence to try and determine the best strategy for individuals who did start with Johnson & Johnson So at this point in time, this third dose is available to individuals who received the mRNA vaccines, that is Pfizer or Moderna. And again, it's for individuals who are moderately to severely immunocompromised. Kathryn, I'll turn it back to you.
And Jen Fleisher is now going to talk about how people can receive their third dose if they are eligible.
Thanks, Kathryn, and good afternoon. So in order to fulfill the need to get third doses for the moderately or severely immunocompromised population, we'll be offering immediately by appointment only those third doses via the local health department vaccine sites. We are in each locality at least 1 day a week offering that. We also have third doses available at Moby on the Mall. This is our event in partnership with the city of Charlottesville on the downtown mall close to the pavilion. And that is on Mondays from 1 o'clock to 3 o'clock p.m. We also will be offering third doses at our J. Crew mass vaccination site at Fashion Square Mall. And for any homebound patients that we've served previously with their first and second doses, we can provide their third dose with that homebound vaccination service. We also have reached out to primary care providers, as has the state, and they are required to offer the third dose if they have been offering vaccine previously. And local pharmacies throughout the district, particularly CVS and Walgreens, are both offering third doses, again, of both vaccines, Pfizer and Moderna. Calling ahead to either one of those will give you the most current information as far as their availability and drug availability.
All right, thank you, everybody. All right, we will now move into question and answers with our reporters. So anyone who wants to ask a question should raise their hand. I will allow for you to talk, and you will be able to ask 2 questions, and we will do 2 rounds of questions. All right, Carly, we will start with you from NBC 29.
Hi, Kathryn. Good to see you again. It's been a while.
Thanks.
So I was wondering if you were aware how hospital capacity is right now in the area. Are we able to take in more people?
That is a great question. I will say I do not know that right now. Dr. Bonds, if you can share.
Yeah, I don't have the exact numbers right now in front of me. We have not heard of any capacity problems in our area. We're fortunate that we have 2 major medical centers, and they have a pretty significant ability to expand and contract their services. Certainly hospital capacity in other areas of our country are having real problems, but again, there's been no indication that this has been the case here in the Northwest region or really across the state of Virginia generally. I do think it's really important to remember, though, that that's one of the reasons why we are putting these mitigation measures and really recommending people get vaccinated and wear masks when they're out and about so that we can keep hospitals from becoming overloaded.
Awesome. Thank you.
And Carly, do you have a follow-up question?
Not at the moment. I'll wait for other reporters to ask the questions.
Okay, great. All right, next we will move over to Mac from Daily Progress.
Howdy, folks. Just a quick curiosity question. If you're going in to get that third that booster shot, what do you have to take with you to prove that you actually qualify for it? I remember wasn't that long ago we had people swarming Roanoke and Danville, in a panic to get their shots. Just thinking that could happen again. What do you need to have to get that booster?
So Mac, I can answer that. You just have to have an appointment. So once you have that appointment, and be immunocompromised. There isn't formal documentation that is needed beyond a medical questionnaire that's part of all intake for that appointment. So those are the real requirements for getting that third dose.
Cool.
Any follow-up question, Mac?
Oh, I'm with the other one. I'll wait and see what everybody else comes up with. I'm not that original.
All right. All right. So then Max with NBC 29, you're up next.
Can you hear me now?
We can. There you go.
All right. I was just saying thanks for hosting this and taking questions. I wanted to kind of bounce off of Mac's question and ask, if there's not, formal documentation. I know some of the messaging can be a little confusing for who is eligible. There are these broad categories when you say certain medications, not everyone may know. What is the best way for someone to know if they do fall into that immunocompromised category?
Well, that's a really great question. I think the best way is for an individual to talk to their physician and see if their primary care or the physician that's providing care for their underlying condition recommends that third dose. We at the health department won't necessarily have all of the background of that individual, and so we can't really make that call. And so we rely on physicians to do that. So I think really the first step is, if you think you fall into one of those categories, is to call up your physician's office and talk to someone over the phone from that office and ask if they recommend that you get that third shot. And if they do, then you can go online, make an appointment, just answer yes to the question that asks if you have an immunocompromised condition, and we'll be happy to provide that vaccine.
All right, thank you. I will, I'll reserve a follow-up as everyone else has done.
Okay, thank you. I don't see any other hands raised, so we will move to round 2 of asking questions from our reporters. Please raise your hand if you have a question to ask. All right, Sandy, I see you're here. All right, Sandy, I'm trying to unmute you. Let me know.
There we go. Sorry about that.
Oh, perfect. All right,
Yeah.
what is your
I
question?
think we would all be up to speed on this stuff. I was asking whether Dr. Bonds or anyone else would care to speculate on the impact of students returning to UVA campus this week. Is it likely that we're going to see cases, or because these students are vaccinated, is there really no risk?
There we go. That's a great question. The students are all required to be vaccinated, and UVA has put in place a mask requirement while on grounds in the inside of a building for the first month, and they have the option, of course, to extend that. And those are really great mitigation measures, and I applaud UVA for really taking those mitigation measures. We do know from other parts of the country that Delta is a little bit different than the previous variants that we saw. Individuals who are vaccinated are infectious if they become infected with the Delta. That is, they are going to spread virus particles. But the really good news is that the individual who has that vaccine is protected. So while we might see an uptick as students return, and that could be all students, K through 12 students, preschool students, or our university or our community college students, because we will have more individuals in a congregate setting. I think people can take really important and critical steps by becoming vaccinated. What we saw in the Provincetown, Massachusetts outbreak that occurred over the 4th of July was that we did have individuals vaccinated who became infected, but they were protected from the really severe consequences of the disease. They didn't end up in the hospital and they didn't die. And that's a really powerful statement. And so I would just use this opportunity to encourage anyone who has not yet been vaccinated, who's been sitting on the fence, to really take that step forward and start their vaccination process. It's going to keep you safe.
And do you have any data suggesting progress in terms of interesting communities of color in getting vaccinated? Are we seeing more patients of color coming in for vaccine?
So you can look on the VDH website and our website to find out the percentage of individuals in various racial and ethnic groups who have been vaccinated. We're still seeing a bit of a lag in Blacks and African Americans in regards to getting vaccinated, but we have a really robust outreach effort that's going on, and really dedicated community health workers that are reaching out to those communities and really trying to answer people's questions, reassure them, and help them get vaccinated. So I think in our community, we're really taking all of the steps to try and equalize that inequity. Certainly, there's plenty of vaccine, and we are happy to come to any neighborhood or any event to provide vaccination. And if you can't leave your home or you don't want to be seen going into Moby on the mall, you can call us and we'll set up a homebound appointment for you to get vaccinated.
Thank you.
All right, thank you, Sandy. And we'll go back over to Max.
All right, thank you for the follow-up time. Immunocompromised people aren't a huge percentage, but there are a good chunk of them in our community. Will you have enough vaccinations for as many, if not all of them, who want that third dose? And do you see any supply issues rising because of it?
I can answer that one. We do not anticipate a supply issue at this point. We know that immunocompromised folks generally nationwide are about 3% of the population. So if we apply that here, we should be prepared for the uptick. And so right now we are planning for that, and we have the supply to meet that demand.
All right, Max, and you can ask your follow-up. I unmuted you there.
No, I wasn't sure if I had another. I was just going to say thank you and we can move on.
All right, thank you. And then we will go back to Mac, your turn.
Hey, just, I guess, well, two things. First off, a crystal ball question, which I hate because mine fell off my desk and broke. Are we going to be, do you think we're going to be, or do you fear that we're going to be looking at the same kind of thing we saw last January with Thanksgiving and Christmas coming up? Are we doomed to repeat our previous history going way back to 1918? Not including last year. You know, we just seem to do that for some odd reason. But what's the future look like with this Delta thing?
Dr. Bonds, would you like to answer that?
Sure. Alas, my crystal ball exploded. So I think the difference this year is that we have 3 effective vaccines, and we know that they work, and they work against the Delta variant. And the sooner that we get people vaccinated, the less likely that we will have yet a different variant occur. The variants happen when spread happens. That's an opportunity for the virus to change its instructions and mutate. And if we can stop that spread, then we can lower the risk that that's going to happen. Again, I think it's really in our control at this point in time. If individuals get vaccinated and use really the mild mitigation measures of wearing a mask in crowded indoor spaces while the Delta is quite prevalent in our community, I'm cautiously optimistic that this will die down. You know, this has really been the great unknown. It's a pretty clever virus, if we want to attribute human characteristics to it. So it's impossible to predict, but again, we have tools in our toolbox that we can use to prevent that big spread over the holiday season. But they need to get vaccinated now.
All right, and Mac, did you have a follow-up question?
And is the booster shot, is it basically the same as a regular first dose or second dose kind of thing? Or is there more I mean, is it a bigger dose or same thing?
Yeah, so I'm going to start just by correcting. It's not really a booster. This is actually going to be considered the third shot in your vaccination series. A booster would be something that we give because we think your immunity is waning. And that might happen to everybody at some point in the future, but not at this point in time. So what we're talking about is really, we've just added a third shot to the series for a specific group of people. It is the exact same dose as you would have gotten the first time. And again, it's preferable that you get the same vaccine that you started with. So if you started with Pfizer, your third dose is Pfizer. If you started with Moderna, your third dose is Moderna. But it doesn't have to be. Both the FDA and the CDC have said that you should take whatever that third shot is available. So if all we have is Pfizer, that's what we're going to provide for you.
Okay, and our last questions will come from Sandy. You weren't here for the first round of questions, so we'll let you ask 2 more. And if anyone else has any questions in the meantime, please raise your hand.
Thank you. First of all, Dr. Bonds, based on clinical trials where people were getting vaccine before the general public, what do we know about the longevity of the vaccines? How long do we think they're effective before someone would need a booster?
Yeah, so that's a really great question. And I'm going to say studies are ongoing. We do know that some countries like Israel are beginning to adopt having a booster for individuals. And I think we'll see that likely coming at some point in the future. The ACIP group talked a little bit about it last Friday, and you can go online and see what the comments and what evidence they presented, but no decision was made. And we wouldn't offer one until they come up with a recommendation. Right now, their next meeting is scheduled to be for October. They can, of course, call a ad hoc meeting at any time. But that's really the best place to look for that, both cumulative evidence, because they've got some really nice summary slides, but also when that recommendation does come. I think the critical thing will be variants. Right now, we know that the current vaccines work against the Delta variant and keeping people out of the hospital and keeping them alive. And so I think it really depends a little bit on variants coming down the pike. And again, the best way to control that is to get everyone vaccinated.
And I'm not clear about the situation with children. Do we find that the Delta variant is more likely to infect and cause serious disease in kids? And when do we think FDA might approve a vaccine for school-age children?
Yeah, so that's a great question. We are seeing infections of kids. Some of that is because they're spending time together. So we didn't have summer camps last year. We had lots of summer camps this year. That's an opportunity for kids to be in close quarters indoors and perhaps not be vigilant about wearing their masks. We have seen in other school districts across the country that have started, there are outbreaks of kids getting infected with Delta. And there does seem to be more children in hospitals anecdotally. I don't have good summary statistics on that right now. I'm going to quote one of my colleagues, Danny Avula, who said at a press conference last week that he thought vaccines would be available on an emergency use for 5 to 11-year-olds sometime in September. As the state's vaccine coordinator, he is better positioned to know that than I am. And that would be really fantastic news because that's a group of individuals that spend every day together in school and really puts them in an opportunity to be around lots of people, some of whom could be infected. So hopefully for the kids, It'll be in September, but again, I'm just quoting our vaccine coordinator. I have not seen anything from the FDA or the CDC that says that.
All right, thank you.
Okay, it doesn't look like we have any other questions, so we will wrap up now. Thank you to everybody who attended and is watching this live. We will continue to provide information ongoing as we ramp up all of the third dose vaccinations and continue in our COVID response. And as usual, we recommend people visit our website or call our hotline. Our website is blueridgehd.org. And our COVID-19 hotline is 434-972-6261. And visit our website or give us a call and we'll provide you with information about upcoming vaccine clinics. Thank you.